Hi, my name is Dr. Emmanuel MONNERON and I work as a psychiatrist in France, and this is Pride Month edition of Psychiatry and the Troubled Teen Industry. If you don't know what the troubled teen industry is, you can follow the links in the description of this video to find useful information about the troubled teen industry. This new video is going to be about gender dysphoria, the LGBTQIA plus community in the troubled teen industry, and conversion therapy. A few months ago, I've started working with two medical networks promoting and providing healthcare for transgender people, and especially for people wanting to transition. Because of that, I have started to meet trans people more frequently now, and it made me want to talk about gender dysphoria and how I understand it. Before I start, I want to say that I have never experienced gender dysphoria and that I don't want to talk for the people who have. So if you want to give more information or talk about your own experience, please feel free to comment this video. Gender dysphoria is the painful tension that some people might experience when their gender identity doesn't match their birth-assigned anatomical sex. People experiences gender variance such as transidentity, gender fluidity, and non-binary sometimes feel this psychological pain related to dysphoria. This pain can be permanent, but it can also disappear or intensify depending on the time in life, the interactions with people, or the circumstances. For example, a lot of people describe puberty as a very challenging and painful time because of all the body changes that happen at that age. It also seems like being in places where the body is exposed, such as locker rooms or swimming pools, can intensify gender dysphoria. Finally, feeling the obligation to behave according to another gender, or even worse, being forced to do so, can really intensify the psychological pain related to gender dysphoria. It can be quite difficult to identify gender dysphoria, especially for a child or a teenager, and also if gender variance is not a topic discussed in the youth environment. That's the reason why the psychological pain associated to gender dysphoria can be expressed in many different ways in children and teenagers, such as hyperactivity, depression, self-harm, or violence, and lead to wrong diagnosis and inappropriate treatments. Furthermore, even when the dysphoria is identified as such, the pain can also cause serious symptoms such as anxiety, depression, or even eating disorder. For example, some trans boys stop eating during puberty to limit the growth of their breasts and their hips and to block their periods, which are body changes that can dramatically intensify the dysphoria. Available data show that trans women are 19 times more likely to commit suicide compared to the general population. The troubled teen industry is a network of so-called therapeutic one-size-fits-all programs for struggling children and teenagers. Considering the amount of psychological pain LGBTQIA plus youth can experience and the symptoms and wrong diagnosis that come with it, the fact that this community is well represented in the population hosted by TTI facilities is not that surprising. When the youth themselves don't know exactly why they're hurting, and when their parents are not informed enough because of a lack of resources or because of religious or political convictions, looking for inappropriate help is a very likely outcome. Most TTI programs are heteronormative. Girls and boys are usually split up in different groups and stay in different parts of the facility. In most programs, there are very strict rules about the way they are allowed to interact. In most programs, even making eye contact is forbidden and severely punished. Some testimonies of former residents explain that in some facilities, the girls were required to lay down on the floor, facing the ground each time the boys were around. In these programs, the residents are taught that they should be ashamed of their sexuality, and masturbation is often considered a major rule breaking. Of course, this environment is probably the worst thing you can imagine to help a teenager who is struggling with their sexual orientation or gender identity. But there's even worse, and it's called conversion therapy. Conversion therapy is the pseudo-scientific practice of trying to change an individual's sexual orientation or gender identity using psychological, physical, or spiritual interventions. There is no reliable evidence that sexual orientation or gender identity can be changed, and medical institutions warn that conversion therapy practices are ineffective and potentially harmful. Depending on the testimonies, survivors describe practices such as being forced to dress and behave according to what is expected from the other gender, being shamed by groups of residents and therapists because of their sexual orientation or gender identity during attack therapy sessions, or being punished for expressing their feelings. And I'm talking about losing the right to talk or being isolated for days, weeks, or months. Some children and teenagers also had to face terrifying exorcism sessions, violence, electroshock therapy, or what these people call corrective rape. Although conversion therapy has been legally banned in several states in America, it's clearly still happening behind closed doors, in unregulated private facilities, and also in some religious programs protected by religious exemption laws. As I already said it, there's absolutely no scientific evidence proving that conversion therapy works, but it clearly teaches self-hatred to already vulnerable LGBTQIA+ youth. Considering how violent these methods are, it also causes post-traumatic stress disorder and all the comorbidities associated to this disorder. The fact that it increases the suicidal risk in this population is also pretty likely. Since the beginning of Pride Month, I have heard and read many comments about a so-called gay lobby promoting the LGBTQIA+ lifestyle. I want to end this video by saying that being LGBTQIA+ is not a lifestyle, it's not a choice, and thinking that it can be promoted simply doesn't make sense. Talking about this community and how stigmatized it is, taking care of them or giving them proper medical information are not ways to promote anything. For example, I know a lot of things about gender reassignment surgery, but it doesn't make me interested in being operated. Informing people about gender variance is not going to make anybody trans or non-binary, but it might help people who are struggling with gender identity and the people around them understand better what is happening, what kind of help is needed, and what is available when it comes to healthcare. It can truly save thousands of lives. If you feel like you need help, I encourage you to contact the Trevor Project. Their number is in the description of this video and you can call them 24/7. The fight against the troubled teen industry is far from being over. If you want to get involved, make sure to sign the petitions, follow some survivors' organizations' accounts on social media, share the content, and talk about this important fight around you. All the links are in the description. If you liked this video, feel free to share it, to click the like button, and if you want to see more videos, make sure to subscribe to the channel. Thank you very much for watching. There will be more videos soon. Thank you.